Welcome to The Deep Dive, the podcast where we sweat the small stuff so you don't have to. From real stories to expert advice, we're here to uncover everything about hyperhidrosis and empower you to take control. Ready to dive into the world of sweat and solutions? Let's make a splash.
All right, let's dive into something kind of personal, maybe a little awkward for some folks. We're talking excessive sweating, specifically between the legs.
Yeah, not exactly a topic you bring up at a dinner party.
But hey, let's be real. It's something a lot of people deal with.
Definitely more common than you'd think. And certainly nothing to be ashamed of.
Oh, right, totally.
It's interesting. Men actually tend to sweat more than women.
Oh, really? I would have thought the opposite.
It's true. It's all comes down to physiology. But listen, regardless of, whether you're a man or a woman, everyone sweats. It's just our bodies, regulating temperature. It's natural.
Right.
What we're going to do in this deep dive is try to understand, when does that normal perspiration, when does it become excessive?
Right.
And maybe even a sign of something else going on.
Okay, that makes sense. So we've got this Healthline article, and it's called "How Do I Stop Sweating Between My Legs?
Okay.
Causes and Treatment." And they really kind of lay out the landscape here. And it seems like, excessive sweating down there can be caused by a whole bunch of different things.
Exactly. It's like a mystery.
Yeah.
You got to figure out the why, and that's crucial to finding the right solution.
Right. So let's play detective here for a minute. The article, it lists a ton of different potential causes.
Okay.
Some I wouldn't have even thought of. So for women, it mentions things like menopause, pregnancy,
Right.
certain medications, and even anxiety
Oh, wow.
as possible culprits.
That's wild.
It's crazy, right?
It is. And it just highlights how interconnected our bodies are,
Yeah.
For men, low blood sugar can play a role.
Okay.
Diabetes.
Interesting.
And even family history. So if your dad, struggled with excessive sweating, you might be predisposed to it as well.
So if someone's dad was a heavy sweater, are they destined to follow in his footsteps?
Not necessarily, but family history can definitely increase your chances.
Right.
You see, when blood sugar levels fluctuate, it can trigger the autonomic nervous system, which is also responsible for regulating our sweating. So there's a connection there that a lot of people wouldn't expect.
Oh, that's interesting. Okay. The article also mentions something called hyperhidrosis.
Right.
What exactly is that?
So hyperhidrosis is a medical condition where you experience excessive sweating.
Okay.
That isn't simply due to, heat or exercise.
Got it.
Basically, your sweat glands are just on overdrive, even when there's no real need to cool down.
So if someone is just sitting at their desk sweating buckets, that could be a sign of hyperhidrosis.
It's certainly possible. And that's why it's crucial to understand the root cause of the problem.
Right.
We're not just talking about discomfort here. It could be a clue that something else is going on in the body that needs attention.
Okay, so we've talked about some of the causes, but what can people actually do about it?
Right.
The article outlines a whole bunch of practical tips, starting with simple lifestyle changes.
Right, like choosing breathable fabrics for your clothes,
right,
showering regularly, and even avoiding certain foods that can trigger sweating.
Okay. So that seems pretty straightforward. What kind of fabrics should people be looking for?
Natural fibers like cotton and linen are great because they allow your skin to breathe.
Okay.
You want to avoid synthetic materials like polyester because they tend to trap heat and moisture.
Makes sense.
No.
And what about showering? Twice a day? More?
It really depends on your individual needs and activity level. But generally, showering once or twice a day with an antibacterial soap can help keep sweat and odor under control.
So we've got hygiene covered. What about those trigger foods you mentioned?
Right.
The article, it says that certain foods can actually make sweating worse. What should people be avoiding?
So spicy foods are a big one.
Okay.
Caffeine and alcohol, those are kind of the usual suspects. They can raise your internal temperature.
Right.
And, send those sweat glands into overdrive.
So maybe skip the hot wings and tequila shots if you're prone to sweating.
Yeah, probably a good idea.
All right. Okay.
And, this whole discussion about triggers and lifestyle changes, it's a good reminder that we have more control over our bodies than we sometimes realize.
That's true.
Simple adjustments can make a big difference.
Yeah, that's a really good point. But what if those lifestyle changes just aren't cutting it?
Right.
The article mentions medical treatments too, like prescription strength antiperspirants.
Yeah.
How are those different from the stuff you can just buy at the drugstore?
So prescription antiperspirants, they contain a much higher concentration of aluminum chloride,
Okay.
which is the active ingredient that basically blocks those sweat ducts.
Mm-hmm.
So things that like, plugging up the pipes, so to speak.
Gotcha. So it's just like a more powerful version of the regular stuff. What about Botox? That seems like a pretty surprising treatment for sweating.
It is. But Botox has a surprising number of medical applications.
Oh, right.
Beyond the cosmetic uses that most people are familiar with.
Right.
In this case, with hyperhidrosis, it works by blocking a neurotransmitter called acetylcholine, which is responsible for sending signals to the sweat glands.
Okay.
So essentially, it kind of turns them off for a period of
So
time.
it's not a permanent fix.
Right. The effects are temporary, usually lasting for several months.
Got it.
So you would need repeat injections to maintain the results.
Okay. And then there's surgery, which I imagine is kind of a last resort.
Right. Surgery is definitely reserved for severe cases
Okay.
that haven't responded to other treatments.
Right.
And even then, it's not a decision to be taken lightly.
Yeah.
There are different types of surgery. Some are more invasive than others. One common procedure involves cutting the nerves that trigger excessive sweating in the affected area.
Wow, that sounds pretty intense.
It is a serious procedure.
Yeah.
And there are always risks involved.
Yeah.
That's why it's so important to, explore all other options with a doctor.
Right.
Before going down that road.
Sure.
They can help you weigh the potential benefits against the risks.
Okay, so we've got lifestyle changes, we've got medical treatments,
Right.
We've even got surgery as a possible solution here.
Right.
That's quite a range. I'm sensing a but coming here, though. What's the catch?
There's no one-size-fits-all solution. What works for one person might not work for another.
Right.
And that's why consulting a doctor is so crucial.
Right.
They can help determine the best course of action for you based on your individual needs and circumstances.
Yeah, that makes a lot of sense. It's not something you want to just like self-diagnose and treat on your own.
No, definitely not.
Especially with something as complex as, hyperhidrosis.
Absolutely.
Right.
A good doctor can guide you through the various options, explain potential side effects, and really help you make an informed decision. That's good advice.
Speaking of informed decisions, the article also stresses seeking medical advice if you notice other symptoms alongside the excessive sweating.
Right.
Why is that so important?
Well, excessive sweating can sometimes be a symptom of an underlying medical condition.
Oh, okay.
So it's a clue that something else might be going on.
So it's like a warning signal almost.
Exactly.
Okay.
If you're experiencing other symptoms, it's essential to get a proper diagnosis to rule out anything serious. Don't just dismiss them as, harmless inconveniences.
What kind of symptoms should people be looking out for?
Things like a strong odor that isn't easily managed with hygiene,
Okay.
persistent skin irritation,
Gotcha.
or even pain in the affected area.
Right.
These could be red flags that require further investigation.
And as the article mentioned, a sweaty groin can be a breeding ground for infections, right?
That's right. That warm, moist environment can be a haven for bacteria and fungi to thrive,
Oh, wow.
leading to problems like jock itch or yeast infections.
Yikes. Okay. I'm definitely getting the message here.
Yeah.
It's not just about discomfort, it's about protecting your health too.
Exactly. It's about recognizing that excessive sweating can sometimes be a sign that something else is going on,
Right.
and seeking professional help to address the root cause.
Yeah, that's such an important point. It's easy to just kind of downplay sweating as just an annoyance,
Right.
but it could be, our body's way of telling us something's off.
I completely agree. We've covered a lot of ground here today,
Yeah.
from the potential causes of excessive sweating to, the wide range of solutions available.
Yeah, it's been a fascinating deep dive for sure. We've tackled the symptoms, the science behind it.
Right.
We've even debunked the myth that it's, something to be embarrassed about.
And hopefully our listener feels more informed and empowered to tackle this issue head on,
Right.
knowing that there are effective ways to manage it.
It really has been. I mean, I've definitely learned some things. It sounds like knowledge is power, right? When it comes to, dealing with this.
It really is. I
Yeah.
mean, understanding what's going on can make all the difference in finding a solution that works for you.
Yeah, that's a good point. So as our listener is wrapping up, their own deep dive into this topic,
Right.
What's the one thing you hope they take away from our conversation?
I think the biggest takeaway is that excessive sweating, especially in the groin area, is a surprisingly common problem, and it can be caused by, a wide range of things.
Yeah.
From lifestyle factors to even underlying medical conditions.
Right.
But the important thing is to not ignore it.
Right.
Don't just brush it off as simply embarrassing,
Right. And there's no need to suffer in silence.
Exactly.
There are solutions out there.
Yeah.
From simple tweaks to your routine to more advanced medical interventions.
Exactly. And finding the right solution for you might take some trial and error. But it all starts with taking that first step.
Sure.
Seeking guidance from a healthcare professional.
Right.
They can help you navigate the options and make an informed decision.
And remember, you're not alone in this. More people experience this than you might realize, and there's no shame in getting help.
Absolutely not.
Yeah.
This whole conversation has me thinking about something.
Okay.
We've talked about, all these various causes of excessive sweating.
Right.
But I wonder if our modern lifestyles, with all the stress, the processed foods,
Yeah.
the artificial climate control,
Interesting.
could those things actually be contributing to an increase in this problem?
It makes you wonder, right? It makes you wonder if our bodies are trying to tell us something,
Exactly.
about the way we live. It's definitely something to ponder.
It's a complex issue with a lot of factors at play.
Well, there you have it. We went deep, maybe got a little personal, exploring the often ignored world of excessive sweating. Hopefully our listener feels a bit more knowledgeable, a lot less alone, and ready to take control of this issue. Until next time, remember, stay curious, stay informed, and don't sweat it. Literally.
You've been listening to The Deep Dive because understanding sweat is the first step to thriving. Remember to subscribe, share, and connect with us on Hyperhidrosis Awareness Kenya socials. Together, we can stay cool, confident, and unstoppable. Until next time, keep shining. No sweat.